Back to mid-morning. October is Audiology Awareness Month.
Bluegrass Hearing Clinic is here today to explain treatments for various hearing issues. And joining us now is Dr. Cain. Thank you so much for being here with us
Thank you so much
today.
for having me. Thank you.
Tell us about the work that you do.
So I'm an audiologist, so I specialize in the treatment, management of hearing loss and balance disorders. At my role at Bluegrass Hearing Clinic, I focus mostly on hearing aids and cochlear implants.
You hear hearing, but you also mentioned balance. How do those two tie into each other?
Yeah, so your inner ear is responsible for your hearing and your balance, so those two systems communicate with one another to make sure that you stay in equilibrium throughout your day-to-day life. So we can focus more on the hearing side. We also have testing for the balance side as well at other clinics that specialize in those areas.
Is there a certain age where people should start coming to see you to get screened for hearing loss?
So you can actually start getting screened as an infant. And then throughout your life, I recommend getting hearing screenings every 1 to 2 years, just to make sure those systems are working appropriately.
Does it tend to be gradual? People not really notice that they're missing things?
Yeah, it does. A lot of hearing loss is high frequency hearing loss, so it's going to be the crispness of speech, the consonant sounds. So some people don't really realize that they're having hearing problems until they can hear people, but it's not very clear. Then they come and see us. So that's really where we kind of start.
The work that you do can be life-changing. My grandma just got a cochlear implant and relearning how to hear and whatnot, but finally being able to hear. What's that like for you to be able to get patients to that?
Oh, it's rewarding. It's very rewarding. That's really the reason why I became an audiologist. I went to the University of Cincinnati and I had a lot of immersive learning opportunities with cochlear implants. I got to see a surgery and then I got to see an activation, and that one click of a button and changing somebody's life is really the reason I chose audiology as a profession.
So we talk about being able to hear better, but you all also help with other issues like tinnitus. Is that a thing that you see?
Yeah, tinnitus, tinnitus. Yeah, everyone says it differently, but we do help with that. We do evaluations for tinnitus. Most of the time, tinnitus is actually a side effect of untreated hearing loss. So we check the hearing first and see if they have an underlying hearing loss that might be causing the problem, because the treatment for tinnitus is hearing aids and some tinnitus retraining therapy, some sound therapy, and we can see and work out a plan for people who have that issue as well. So.
Now, where are you located at?
So we have 10 locations. We are moving out of a location currently, so it's going to be 9 locations. We are in Lexington, Richmond, Bardstown, E-Town, Mount Sterling, Paris, and actually down in Somerset. We have a lot of different locations across the Commonwealth.
All right, and people, do they contact you directly or they refer to you? How does that normally work?
Yeah, you can give us a call, or you can go on our website, and we have an area where you can tap in and give us some information, and then we'll reach out to you to make an appointment.
All right, thanks so much for talking to us.
Of course, thank you so much. It was great meeting you.